Oh, you guys, we're back at the P4 Medicine Institute in Seattle. Dr. George is hanging out with us. We're going to go take a look at what an executive wellness suite looks like. When you're coming in here for your testing, when you're coming in here because you want to make sure you're going to live a longer, healthier life trying to optimize this machine, what does it look like when you come into a place like this? And again, this is the doctor's office of the future, you guys. I'm not sick. We're hanging out here because there's some really cool things that are going to happen. So you're going to take me through, a regular person, through an entire day of intense testing, yeah?
You know what, if you're doing an entire day of testing, you might as well be comfortable, you might as well have some privacy, kind of have an exclusive feel. So let's go ahead and show you the suite.
Come this way, you guys, you lead.
All right, so when you come to my clinic, you'd come fasting, no coffee, no tea, and the first thing we do is we'd welcome you into your own personal suite.
Oh, the view sucks already. Look at that. Okay, maybe the windows need to be cleaned, guys, but check this out. This is mine for the day.
Yeah, we're doing this because, you know, it's a long day. It can be emotional. I've had people really, I mean, when you learn about yourself, when you spend the whole day learning about yourself, it's an emotional experience. People need time, and we pace the day so that people can sit here. We serve both breakfast and lunch right here. It's all day testing. We want to give people some special privacy and a really exclusive feel.
Cool. You guys, hey, look, I'm over here. Hi. When's the last time you took an entire day and spent it on yourself? Not at the spa, not out drinking, like learning about what the heck you're made of and what's going to make you stronger, better, and a better performer for the people who love you and need you tomorrow than you are today. This is a great place to do it. All right. Check it out. You guys want to keep going? Let's keep going. Let's see what else is in store for us here. What's next? Let's look at what happens when we're done with the day. Right? Where do I go, right? Where do I just leave? Kick me out, like your doctor does? Just get out. Get out on the street with the rest of the sick people. Or do I get to a nice place to shower and relax and kind of take my time? So let's take a look at what that looks like. You guys ready?
All right, yeah, so at the end of the day, when you've done your full metabolic exercise testing, we let people relax, people take a nice shower, and then we welcome them back into the suite, and we offer lunch, and we do a day one follow-up.
You guys, that's a nicer shower than most people have at home. So this is not your regular doctor's office. I'm going to keep saying that because this is a place where you come to learn about you and to get better. Not because you're sick, but because you want to live longer. Cool. All right.
So you know what? Let's go. Do you want to look at POCUS? Look at what we call point of care ultrasound.
How does that sound? Point of care ultrasound.
We also call it POCUS, not hocus pocus. We
just
call
POCUS, no hocus.
No hocus, right?
No hocus. Let's go look at POCUS.
POCUS.
Okay, right. That sounds intriguing, right? Do you guys want to see?
Actually, let's get Jordan so we can demonstrate it.
We're gonna. Right. Yes, Jordan.
Jordan, can you join us for POCUS?
All right, you guys are gonna watch. You guys are gonna get to see inside of Jordan. I'm excited for this.
All right, where is Jordan?
He probably ran away because he knows we're going to look at his arteries and veins and liver and stuff.
I've looked at Jordan's insides many times.
Well, we're going to find Jordan, and then, oh, there he is.
I'm hiding.
Yeah, he's hiding because he's like, no, you can't see inside me. You guys ready? You're about to see the ultrasound of the future. This is what you will be starting to see 10 years from now. You guys, this is so far ahead of the curve here in Seattle at the P4 Medicine Institute that this isn't, you're not going to see this anywhere else. Hey, this is super cool. I'm sure the lights will go on as we go in, yeah?
Well, actually, we want them off.
Oh, we're going to keep them off.
We want to see the screen.
Oh, we're getting all dark and... All right, you guys, Jordan.
Hello.
That's Jordan on the table. Jordan, what's your role here at the Institute?
I am our lead exercise physiologist, so I basically do a lot of work surrounding our lifestyle interventions related to exercise.
Cool. Right. Cool. And Doc, where are you putting this thing?
All right, actually,
just an ultrasound.
So this is what we call a 21st century physical examination, right? So the exam that most of us get when we go to a doctor was basically developed by German doctors in the 1880s, right? That's
We're so far ahead.
Right, so that's the exam where the doctor feels your neck, feels your abdomen, puts a stethoscope on your chest. That's the kind of exam that takes about 5 minutes. So in this clinic, we tell people, hey, you know, we can do an old style exam from the 1880s, or we can do what we call a 21st century physical, right? So we are using a real ultrasound machine. This machine can do all kinds of ultrasound, and we've developed our own program for what we call scientific wellness. So we're not doing diagnostic imaging, but we're doing what we call an ultrasound augmented wellness examination. And I'll just start here. I'll give you an example. So we're going to look at Jordan's thyroid, first of all.
I'm gonna get a little closer so you guys can see this where he's at.
There it is.
He's on the thyroid,
Right,
and then we're gonna go up and take a look at his thyroid.
There's the right lobe of his thyroid. That's the isthmus. That's what goes over the trachea. This is Jordan's windpipe. Let me show you his blood vessels, right? So that's Jordan's jugular. And you can see the pulse wave form there. This is his carotid artery. I'm going to put Doppler on it, and you'll see his pulse.
Look at that.
Right?
Any occlusions in any of his arterial walls there?
No, I've looked before. No, there's no plaque or.
Damn it, he's healthy.
He's healthy. You'll see. But actually, look at this. Jordan does have a cyst right there. He has a little colloid cyst nodule. It's very small, right? So it's not something to be worried about, but we know about it. That's not something I can feel in his neck, right? So immediately you can see the value of having ultrasound versus me putting my fingers on Jordan, right?
That's super cool.
Let me actually, let's go up his carotid, Jordan, just a little left of neutral. No, just a little bit. You can see here, I'm gonna run up Jordan's carotid, my hand's going up, all the way up to the bifurcation where part of the vessel go, there it goes, and it goes to the brain. But I wanna show you what we can do in terms of looking at Jordan's arterial health. There actually is a way to look at the inflammation amount in Jordan's artery. And this is what we're gonna do now, right? So I'm gonna take the transducer. I made this very complicated prop, right?
Look at that.
So this prop, right? So this basically, this is what you see on the screen, right? This is the transducer. I'm gonna put the transducer this way, and we're gonna cut along the length of Jordan's carotid artery. And then we're gonna measure the thickness of a part of his arterial wall. And that gives us a sense of arterial wall inflammation. So let me switch here. Okay, let me get a little bit more gel. And again, everyone in our clinic that goes through our programs, we do this for them because we want to understand what is the health of their arteries. Okay, and this is...
Notice how he's laying this thing on Jordan's neck. It's in the other orientation as he was explaining.
All right, so now I'm just locating Jordan's arteries. Okay, there it is. So this is Jordan's carotid artery. I'm just trying to find the intima media layer. Oops. Okay, there it is. So we are now going to measure this tiny layer just above the very bright, thick part of his carotid artery up to that little thin, lighter, hazy part. That is his intima, and we're going to measure his carotid intima media thickness. And we can actually do that in an automated fashion. And I'll press here. I'll move it over. There we go. All right, so we can see now the our tool actually has an algorithm. It looks at over 100 images and averages them out. I've done this many times on Jordan, and I always get basically the same result. It's always like 0.41, 0.42, something like that. It's very reproducible. And in Jordan's case, this score indicates that his arteries don't have an excessive amount of inflammation. So this is very normal for a man Jordan's age. if Jordan had a score closer to 0.6 millimeters, and I want to emphasize to people, we're looking at a very small little distance. This is a fraction of a millimeter, and that's how sensitive this tool is, right? So Jordan is 0.41 millimeters. If you were closer to 0.6 or 0.7, that's when we would really search for the reasons. We would ask, why are Jordan's arteries inflamed? We would look obviously into his inflammatory markers in the blood. We would look at his cholesterol profile, and we would dig deeper, right? So at the P4 Medicine Institute, we believe in 3 modalities of biological information. We believe in multi-omics testing, right? That's genomics, proteomics, metabolomics, microbiomics. But we also believe in ultrasound, and in this case, POCUS, point of care ultrasound, right? Because this is a very powerful tool. This is very different from sending Jordan off to some radiology laboratory and having a radiologist report some of this. Jordan is right here. We have 3 important elements to capture this didactic moment, right? And the way to capture that didactic moment is to have the patient or client, the image, and the provider there at the same time, because I can give that kind of feedback to Jordan while he sees inside his own body. We think this is a much more powerful way of doing medicine than just looking at numbers or just talking. So that's part of our exam. In our exam, we also look at the heart, but I think I want to share with you another really special part of our exam.
Doc, can you pick up plaque on this kind of an image as well? So,
absolutely.
So had he been a naughty boy and been eating Burger King and McDonald's and Taco Bell every day and never exercising and drinking heavily, you might even see at his young age a little bit of plaque buildup there. And that is really common, you guys. We have in the United States a very, very large problem with young kids having plaque buildup in their arteries. So it's too early for somebody his age. It's way too early for a 9-year-old that might be suffering from this. So this is a really great tool to get at this early and figure out what we're going to do about it.
So here, I want to also show you an example of how we look at the liver, right? And we don't just look, we do a qualitative analysis of the liver. We definitely look at what the tissue looks like, but we also do elastography. So elastography is a technique to measure the elasticity of the liver. And the basic principle is the more stiff the liver is, the sicker you are. Right, so if you have severe fatty infiltration, if you have sclerosis, if you have cirrhosis, your liver will be stiffer and our tools will pick it up. Our goal here is to pick up the earliest signs of disease. And in this case, we use elastography. It's something like dropping a pebble on Jordan's liver and seeing how that pebble causes a vibration through his system. So the amazing thing that we can now provide people, this is essentially an ultrasonographic biopsy, right?
Sweet.
As opposed to sticking a needle in his liver to see his tissues. Let me give you an example of what that looks like.
Wonderful. He's going to land on his liver. If you guys don't know where the liver is, it's right there.
There it is.
All right, so.
Oh, and you can see Jordan has a nice healthy looking liver.
Wait, is that a baby? Is he?
No. That's a gallbladder.
Oh,
okay. All right. That was close, Jordan. All right.
It's beautiful.
All right. There's Jordan's gallbladder. When's the last time you ate?
We had lunch at.
Okay. Yeah, you're not super. Sometimes right after eating, the gallbladder is contracted. But yeah, I'm just going to scan through his liver a little bit here. Yep, you can see everything looks pretty good. You're seeing little lines here. Those are blood vessels. They can be bile ducts. If we want to check if it's a blood vessel, we just put Doppler on, right? You can see how we're cutting through these blood vessels lengthwise. You can actually see the blood and the pulse a little bit. But I want to show you elastography. Now, Jordan's not fasting, right? So we may not get accurate numbers right now. But our goal here is to... let me position this a little bit here. Okay. Sorry here, Jordan.
No worries.
There we go. Okay. So we're gonna have you hold your breath. Sorry, I'm gonna demonstrate elastography. So that little window is the sample area, right? So we're gonna sample that. Go ahead, hold your breath. Yeah, so we got what would be a normal number, right? So you see this little meter here. If the meter starts ticking over to the right, that means more and more stiffness. If the meter's all the way over, that's like severe diseased liver. That might be end stage.
Is like a little,
Right.
almost like a speedometer. And
It
right
is,
now he's
yeah.
doing well.
So we want people to be under 5.5 kilopascals. That's how we measure elasticity in this case. And Jordan looks good. We are going to check him after Christmas and New Year's this year.
Yeah.
Just to make sure.
To see how things are going after that.
But yeah, and then of course we look at kidneys. We look at kidneys. We look at aorta, right? We want to make sure patients are not developing an aneurysm, right? Especially in older patients, you want to make sure that the size of the abdominal aorta is normal. We look at bladder. On men, we can offer men a unique kind of benefit, right? We can see the prostate usually through a full bladder. So we usually don't have to do a digital rectal exam, right? I can actually see the bladder, we can measure it.
That's amazing.
yeah.
That's a huge, you guys, if you're listening and you're a dude and it's time for that, I'm going to encourage you to find and seek out somebody that can do this instead. That sounds like a lot more comfortable situation.
Yeah, and you know, the idea is we want to offer people the best available technology, and this is it in terms of imaging, right? This is not the equivalent to a full body MRI or something like that. It's not a CT scan. It's actually better than a CT scan in some ways because there's no radiation involved.
Yeah.
Right?
And no contrast fluid.
So this is our vision for a 21st century exam. We're saying let's move on from the German exam that was developed in the 1880s. Let's skip an entire century and do something right. Do something a little more useful for wellness, right? The idea of this exam is to pick up the earliest signs of disease and then take action on it.
Right. You guys know this, right? If you catch a disease very, very early, you might be able to reverse it, change it, do something before it creates permanent damage where you waited too long. So, you guys, this is it. What else is? There's one more thing in the room I want you to.
Yeah, actually,
check
Jordan,
out.
you and I can both come on up. You and I can both talk about this. So, this is a research grade InBody 770. This is. Jordan and I both use this for our patients, and actually Jordan can talk about the specifics of how he uses it. This tool uses electrical bioimpedance to get a great, very accurate sense of how much body fat you have, where it is, how much lean muscle you have. Here we use it mainly for its use as a delta, right? So we put people in programs. We want people to try to lose their visceral fat, improve their lean muscle. It's a great tool for motivating people, right? Because if you check and you see, hey, we're achieving our goals, you know, people feel good, we keep up with the program. Obviously, you know, when people lose weight, you don't want to lose lean muscle. And that's the problem with certain kinds of diets. That's the problem with certain kinds of severe calorie restriction diets. People lose up to 1/3 of their weight in lean muscle. So this is a tool that will tell us, hey, we're doing something wrong. We need to back off. So it's just a fantastic tool to be able to personalize and make the right kind of dietary and exercise recommendations.
Yeah, I mean, it's really just a way for us to, you know, track and make sure what we're doing is working, or, you know, to make sure we're not doing any harm. It's quite fascinating. This thing uses multiple frequencies to determine, because obviously fat tissue is more insulatory. Muscle tends to be very conductive, and so people with more muscle mass are going to have, the current's going to travel differently. But what's also fascinating is this thing it looks at something called whole body phase angle, which essentially is an indicator of inflammation. So we can use ultrasound, blood biomarkers, this to confirm things. It also looks at distribution of water throughout your body, distribution of muscle throughout the body. So for example, people, maybe, you know, we don't have a ton of these patients, but people with heart failure, things like that, you can see, are people storing water? What's going on? You know, maybe if you're just inflamed, leaky gut, right? These are all ways that we can just look a little deeper to give ourselves more information and hopefully be able to create a program that's more effective for the individual.
Yeah.
So this is, you guys, that machine is your bathroom scale that does body fat times a couple thousand.
On steroids.
Yes, very much so.
Yeah.
So, and how often would somebody get on that?
You know, I mean, for our year-long program, we welcome people to do it monthly. I mean, if you're really making major changes and you're doing things, I guess you could do it every couple weeks, but you're not going to see a dramatic change day to day.
Yeah.
Okay, you said something important in there. You have a year-long program.
Yeah, we have a year-long program. People essentially have access to me, to Jordan, and all of our tools here, including our gym and our metabolic laboratory for that entire year.
For the entire year.
Yep.
And that's not typical, right? That's an extended version of what's your normal program?
Our normal typical program, we call it the 3-month cardiometabolic reboot. It starts off with a full day of testing, just like that year-long program. And then it includes 2 weeks of continuous glucose monitoring, right? So all of our patients wear glucose monitoring patches on their arms to be able to see their unique responses to foods and exercise and sleep. That's a part of it. But it also includes 12 weekly exercise physiology sessions with Jordan. It includes follow-ups with me. It includes InBody body composition analysis. We think it's the best way to, honestly, to reboot your system, get you into the right frame of mind, and to get you into Dan's vision for wellness, right? I mean, this is, Dan, the way Dan talks to you guys about this is exactly what we're trying to do here. We're trying to take action on Dan's vision for scientific wellness.
You guys ahead of the curve by a decade. I'm telling you, this is at least a decade ahead of what you're going to see in the doctor's offices. And the reason Dr. George mentioned my program is because I've been talking for at least 6 years about getting closer to living out there than living in here. And this is modern medicine meets my program of human mammals and what we're designed for. And I tell you what, I can't say enough good things about this. We're going to do another little couple of videos. We're going to hook up to the metabolic cart, see what that looks like, and we're also going to jam a continuous glucose monitor somewhere into my left tricep, and you guys are going to be seeing videos all the time from that thing for the next 2 weeks, because I'm going to have something in my body that says, here's what your sugar's doing, dude, and then I'm going to eat some weird stuff and show you guys what Taco Bell does to your sugar versus what eating a really good broiled monkfish like I ate last night does to your sugar, so that you guys can see this is how it's affecting me, and it might be affecting you similarly. So stay tuned. Next video, metabolic awesome sauce coming up real soon. Love you guys. See ya.